Okay, so I went ahead and started recording. So how I want this to happen is it's going to be like always. I'm going to sort of ask the question, and I'm going to have y'all type it in the chat. You don't have to unmute. You can just type what you're thinking in the chat. Okay. So I want you to be as responsible, or not responsible, responsive as possible. And that way, we can get the correct answer out there for everyone else who is not able to join. Okay. So let me make it to where I can see the chat. Okay. And if you have any questions, just unmute, chime in, however you want. Okay. So this is Intro to Pharmacy. This is the exam we'll be taking tomorrow. So you can either take Pharmacy Math or Intro first. Doesn't matter. Okay, so the first one, drug monograph contains many important facts about the associated product, including what? So what are some things that are included on a drug monograph? Anyone? And when you're at your clinicals, I want you to kind of look for the drug monograph, the little paper on top of the bottle. It's all like folded up and stuff. What are some things included in a drug monograph? I don't see anything in the chat yet.
It gives you drug info about the drug, side effects, stuff like that.
Yeah, adverse reactions is one of them. Anything about warnings, something like that, right? So just so you know, all of you who are, in here, if you would like to use the chat, you can. If you want to unmute, you can. But I will need some sort of interaction. So adverse reactions, dosage forms, and warnings and precautions are all things that are included on a drug monograph. What does it mean to be sublingual? If a drug is sublingual.
Under the tongue?
Perfect. Yes. Jade is carrying you guys. Y'all can either type it in the chat. For some reason I can't see it. Is anyone typing? Okay. Too fast? Come on, Norma. Okay. All right. So this one has two answers. So it is a two-component question. So it says liposome targeted drug. So a liposome targeted drug delivery system has an inner blank sac and an outer blank layer. So really this is a kind of a complex question. So a liposome is a fat, it's basically like a bubble it's made out of fat. And so if you know anything about like fats, I guess, the inner is going to be watery and the outside is going to be made of fat, right? Because that is sort of how you have a liposome. So when you see liposome, I want you to think that the inside contains water. The outside is made of a lipid, okay? So the next one, how would you describe a jelly, a medicated jelly? What are some characteristics of a jelly? It is more liquid, right? So if we think back to anything about creams or ointments, those have a lot. So what does an ointment have a lot of?
Oil.
Oil, right? So is a jelly going to be really oily, or is it going to be more watery?
Watery.
Yeah, it's going to be mostly water. Okay, so it will have a drug, but it's going to have a lot of water as a component. Okay, so this one involves insulin. So the situation is a person is using an insulin that is cloudy. And how many of you have seen insulin at your pharmacy yet? Has anyone seen a vial of insulin yet? So if you ever see a vial of insulin, I want you to take a look at it, and you'll see this in the hospital when you do rotations there. It'll be cloudy. And the way that you do it, so I want you to type in the chat if you shake it. Do you think you shake insulin? Does anyone think you do not shake insulin? So yeah, so the thought there is that insulin is a protein. So proteins are kind of unstable. So if you shake it, you'll actually break the protein of insulin. So the way that you do it is sort of, you can sort of put it between your hands, you can sort of roll the vial around, right? So that way you're still mixing it, you know, you're distributing in the insulin, but you're not shaking it and breaking it up, because it'll also make bubbles and, you know, you can't administer that. So that's how you would mix up insulin. Okay, so this one, a patient needs to take 2 different kinds of insulin to control his diabetes. Which advantage does the vial offer over pens? So what is the advantage of a vial over a pen? Someone type me out what the advantage of having a vial over a pen would be. Victoria, good answer. So Victoria basically answered the question, right? Because he has to take 2 insulins with a vial, you can actually draw them up and put them together. Has anyone seen an insulin pen? I know we had some at the sim lab, but has anyone seen a pen at your clinical rotation? So a pen is basically filled already. It's basically a vial with a needle already attached to it. So yeah, exactly what Victoria said, it's already made up. So you cannot mix insulin in a pen. A patient was sold a box of tuberculin syringes to administer his insulin. Why is this a medication error? Why is it an error to give someone tuberculin syringes for their insulin? The needle is too big. No, they're about the same. So they're very fine needles. No, not about blood clots. No, so we're kind of getting there. It has to do with the way it's measured. Someone in the chat type how insulin is measured. Do we use milligrams for insulin? Do we use liters for insulin? No, so we don't use milligrams for insulin. We use what's called a unit. Has anyone heard of that? Unit? So the next time you see insulin at your rotation, I want you to pay attention on how it's measured, or maybe the size of it. So in Jade, I think what you're thinking of is, you know, you have a vial of insulin, right? It's a 10 ml vial. But when you're actually drawing it up to administer it to a patient, you're going to go by units. So when it's insulin, always units. So the problem here is tuberculin syringes are in milliliters. The insulin syringes are in what? Units, right? The insulin syringes are in units, so that is not going to work. All right. A properly trained pharmacy technician is expected to what? I'm going to give you some answer choices, and I want you to just type a no. So I want some responses here. I just want a no, okay? Is it a technician's responsibility to know how to tactfully ask other technicians to look things up for them? So this one is no. So it's not your responsibility to make someone look something up. Is it to rely on Google searches as your main source of information? No, obviously. To know as much drug information as a pharmacist? No, right? It's important for you to know drug information, but it's not important that you know everything that the pharmacist does because there's no way you will. So the answer is to know which drug resources to answer several different types of common drug information questions. So it's about being able to provide the information for the pharmacist if they need to look it up. So if a pharmacist has a question and they say, hey, can you look something up in the purple book? You know what the purple book is, how to look something up, and you know how to provide it to them, okay? All right, aerosols. Can anyone say something about an aerosol in the chat? So what drug comes as an aerosol? What type of drug comes as an aerosol? Victoria, you are right. Right, so it's an inhaler. So you know you've all seen those little rescue inhalers that you put up to your mouth. You do that. Well, it's actually an aerosol that is a drug. So every time you press on it, it'll release that drug. Kind of like you spraying a Febreze can. The Febreze goes out here into the air, but in the aerosol drug, you're inhaling that. Okay, so that is an aerosol drug, an inhaler. Okay, so the word immediate release is pretty self-explanatory, right? When does the drug release if you take an immediate release? It's literally in the question, right? It's immediately. So as soon as you take that, it is already being absorbed to your body. Okay, so now let's think about a delayed release. So that means that we're doing something to the drug that will make it to where it absorbs later in the body. So someone in the chat type something that relates to that delayed release. What is another word for delayed release, or where might you see delayed release? Extended release, that's good. Okay. Yeah, time release, that's good. Melatonin, that's good. So I'm going to ask you, next time you look at a bottle of aspirin, next time you look at a bottle of aspirin, I want you to see if it says the word enteric coated, E-N-T-E-R-I-C. Does anyone know what that means? What does it mean to be enteric coated? Anyone? So the word, yeah, I mean, sort of, yeah, butter shell, yeah, outer shell. But enteric coated means that it won't be absorbed until it gets to your intestines. Okay, so the reason that aspirin is enteric coated is because it will hurt your stomach if it's absorbed in your stomach. And so you'll see a lot of times that one says enteric coated. Okay, so just understand that is that an immediate release or is that a delayed release? Is an enteric coated medication immediate or delayed, right? Delayed, that's good. Before transferring an oral suspension to a smaller prescription bottle, as you, the technician, you should always do what to the bottle? So you're transferring a suspension into a smaller bottle. What do you need to do to that? Shake, right? Why is it important that you shake it? And I hope that some of you have seen this out in clinicals, the antibiotics that you give, yes, to mix it. It'll mostly be at the bottom. All those are right. So a suspension means that it's not uniform. If I said that it was the solution, would you have to shake it? No, because a solution would mean that it's all the same. You don't have to shake that at all. Okay, good. All right. What route of administration is the shingles vaccine given? How is the shingles vaccine given? What route? So this one is not intramuscular. Actually, this one is subcutaneous. Yeah. Shingles vaccine, subcutaneous. What drugs does facts and comparisons provide information for? What drugs? Is it just controlled substances? Is it just over the counter? Is it just, or is it foreign and domestic drugs? Yes. So the answer is prescription meds and over the counter meds. Okay. Facts and comparisons gives both information to his iPhone. Welcome, iPhone. But it gives information for prescription and non-prescription. In adults where in adults, where are IM injections usually given? Arm and thigh, you're close, not really. In the white part. So the white part on me is everywhere. So the buttocks, yes. So if you think about an IM shot, I don't want you to think about, no. I don't want you to think about a vaccine. I want you to think about if anyone has ever gotten an antibiotic shot, like a Rocephin or something like that, they'll give it to you in the largest muscle you have, which is your buttocks, right? If you give it to your arm, it's going to be extremely painful because it's a lot of drug. So they'll give it into a big muscle, which is the buttocks. Yeah. Okay, so earlier I talked about basically like a ball of fat. So that had a word, and I want you to type it, and then I'll give the answer. This is a way of delivering a drug. So we can use these to deliver a drug. Does anyone know the name that I'm talking about? Lipid is close. I will tell you the beginning of it starts with LIP. So I'm looking for the word liposome. Okay, so liposome is a method of targeting with drugs. So it is a unit of drug, it's a drug delivery, and it will target, so liposome. Okay, what does it mean to have two different references? What is the term that describes using two different references to see something? Anyone? Yes, to cross-reference, right? So that means you are using another resource to check what you already found in another one. So if it's right in both places, that probably means it's good to go. If you're getting conflicting answers in two different places, then it will probably require some additional judgment. Okay, so this question is involving your role as a technician versus a pharmacist. So technicians can help pharmacists look up information, but they should never counsel or require or answer questions requiring what? So questions requiring what kind of judgment? Anyone? What kind of judgment do you not give that a pharmacist can? I'm looking for professional judgment. So what that means is, like I said, if you are finding conflicting answers in two different references, that means the pharmacist is going to have to make a professional judgment based on their knowledge and experience. And it's because they have went through so much training and all that stuff that they have that, that responsibility, I guess. So technicians may be asked to use drug references to perform all the following except what? So do technicians use drug references to learn the details of new labeling requirements? Not really. Do technicians use drug references to identify pills? Is that something you can use a drug reference for? No. Does a drug reference have NDC numbers? So the answer is, so yes. So, and I was wording that weird because the question says except. So on this one, you have to ask yourself, what do you use a drug reference for? So pharmacy technicians do not use drug references to find the best medication for patients. Who does? Pharmacist, right? That is their responsibility. So, you know, when I was talking through that question, all of those other ones were right. You use references for those three things. You don't give professional judgment. This question involves the Handbook of Injectable Drugs. It is a comprehensive guide on all the following except what? So does it have the compatibility of drugs? Does it have anything about compatibility? Yes. Does it have anything about the pH of drugs? If anyone knows what pH is. Okay, not many people are responding, so I'll just talk. It does have things about pH. It also has information about storage. What it does not have is the sterile process for guarding, right? That is up to the technician to know. That is other manuals. We'll talk about USP, all that stuff. It is not going to be in facts and comparisons. Or I'm sorry, the Handbook of Injectable Drugs. The disadvantage of most parenteral routes of administration is the what? So let's think about it. Parenteral means it is through a vein. So if you think about it, what is the disadvantage of having something in your veins? Is it comfortable? Is it painless? No, it's not comfortable or painless, right? It is invasive, it is uncomfortable. So that is the disadvantage of a parenteral route. Would the disadvantage of a parenteral route be that it is slow? No, it is fast, right? So just make sure you understand, like if it's parenteral, that means it's going into someone's veins. You know, that's not really fun. Okay, so this one says the IV bolus. So intravenous bolus. What does that mean, bolus? Does that mean you're, you know, slowly infusing this drug? What would you say about the rate of a bolus? Immediate, right? You're not using time, you're not, you know, letting it, you know, flow into the person, you're not letting it drip or whatever. It is going to be all at once. So usually when nurses or doctors say anything about a bolus, it means they are going to push all the drug in the patient, very rapid rate, so it'll be all available at once. Someone tell me what the purpose of an IUD is. What is the purpose of an IUD? Prevention of pregnancy. Yes. Right. Birth control. Yes. So an IUD is to use to prevent pregnancy. The subcutaneous layer is in between what layers? So subcutaneous is in between what two layers? Skin and muscle, yes, right? Because, you know, if you look at your arm, right, you have skin, and then below that you have subcutaneous layer, and then below that you have muscle. So really there's three of those layers. What advantage does a film coating have over a sugar coating? Is it thinner and lighter weight? Is it thinner? Yes, it is thinner and lighter weight. Is it less expensive to manufacture? Yes. Is it, or does it protect the stomach lining? So yes. So this one's going to be all the above. So it is thinner and lightweight, it's less expensive to manufacture, and it also protects the stomach lining. So if I said this patient takes an XL medication, so an extended release medication, would you say that an advantage is I have to take it more often? Does that sound right? If I take no. So one of the benefits of an extended release medication is that they have to take it less often, right? So normally they would have to take it a couple times a day. Extended release might allow them to just take it once. Okay, so that's a good thing about extended release. What are the two most common types of oral dosage forms? So oral dosage forms. Literally, you can think to yourself, when I walk on the shelves of the pharmacy, what are the most common? Tablets is one. I'm looking for the other one. Yes, tablets and capsules. Perfect. Yeah, and you can kind of double check that. You know, you can walk down the shelves, and I guarantee the majority of them are going to be tablets and capsules. What are the three forms of facts and comparisons that you might find in your community pharmacy? And I think we talked about this in the sim lab, the three different forms of facts and comparisons. Three different forms of facts and comparisons. I will tell you, we talked about it in the sim lab. Okay, maybe this will stimulate your brain. One of them is up, yes, loose leaf is one of them. Perfect. Hopefully that gives you a direction for the other ones. Loose leaf. Anyone else? Do what? I think someone is dialing on their phone. I can't really hear them. Yeah, so you have hard copy, loose leaf, and online. Okay, those are the three forms. What could cause an embolism when an intravenous solution is administered? What could cause an embolism? Would it be that you administered it too fast? So you're saying air, so that could be one. Being too fast is not one of them. It being in dextrose is also not one of them. We administer dextrose all the time. Also, rate doesn't matter. So really, all you're looking for is anything that has any particles. Any answer choice that has anything about particles being in the drug will be the answer. What dosage form provides a fast onset of action for a localized condition with minimal side effects for systemic? So you're looking for some kind of medication form that has a good local effect with minimal systemic effects. It is going to be something you put on your skin. It's going to be a lotion. So patches usually have a systemic effect, but lotion will be a fast onset for a local area, minimal effects in the body. What handheld propellant-driven device would a patient with asthma commonly use? Inhaler, right? A metered dose inhaler. Perfect. What ingredient in a tablet will help break up the solid dosage form once the tablet has been consumed? So it's an ingredient. So you may not know this, you may know it. We're looking for starch. So starch is going to help break it up once the tablet has been consumed. What is the reason a physician might prescribe a delayed release medication? Just like I said earlier, one of the benefits of a delayed release medication is, do you have to take it as often? No. So it allows the patient to not have to take it so often. That is the benefit. What is the other name for a caplet? It's going to be a tablet. Yes. So caplet, tablet. I'm sorry, I'm going kind of fast. We have 7 minutes left. I'm just going to get these few, and then you can watch the recording, okay? Correct process for the administration of otic medication. So you have to know what otic means. So otic, does that mean the eye? No, that means the ear. So you would pull the earlobe down and back for children under the age of 3. Usually you don't have to do that with adults, but for children, pull down and back. Correct technique to administer a subcutaneous dose of insulin. It is below the skin at a 45-degree angle. The route of administration that a drug is administered into the eye, like we said, otic was ear. Into the eye would be ocular. Looking for ocular. The purpose of prescribing a rectal dosage form. So, I mean, there could be a few reasons there, but the biggest one you'll see is to treat vomiting or nauseated patients. You can think about it. If someone is nauseated or vomiting, you don't want to give them something they can throw up. So a lot of times you'll see that for rectal. What is the reason patients often prefer creams over ointments? So when we were talking about that, I said that ointments will have like a greasy look. Yeah. Would you want that to be on your face or anywhere, you know, that's visible? No. So they vanish once applied. So if you're putting it on your face, you'd probably want a cream over an ointment. What is the shelf life and proper storage conditions of most pediatric antibiotic suspensions that are reconstituted or mixed with water? Usually 7 to 10 days at room temperature. So 7 to 10 days at room temperature. What should patients be instructed to use when measuring liquid medications? So really, measuring spoon, obviously. Medicine dropper is another good one. A household teaspoon. So you have to ask yourself, what is the problem with any random person using a household teaspoon? You don't know if it's a true teaspoon, right? You know, I have big spoons, I have little spoons, whatever. To the common person, a teaspoon doesn't mean anything. So really, measuring spoon and medicine dropper are good answers. So this one says when a drug is injected into a kind of internal pool or reservoir so that surrounding tissue can gradually absorb the drug from the pool, this is called a what? So what you need to focus on here is injected into an internal pool. So it's like you're putting a big amount of drug into a person's skin or, you know, subcutaneous. You could think about it as the depot shot. If anyone has heard of a depot shot, it stands for deposition. So it's a depot. That is what that is. So you're putting a large amount of medicine under someone's skin. We're almost there. We have 5 more. So when you're using facts and comparisons, do you ever assume things? No, right? That judgment is for a pharmacist to make assumptions, to make educated guesses. So that is not safe for technicians to make assumptions. Which drug delivery system uses the power of water to push out the drug through microscopic laser-created holes? So really what you need to focus on here is using water to push drug. If you remember anything about A&P or science or biology, it's going to be osmosis that does that. So it is a osmotic pressure system. Which of the following is an example of a multiple compression tablet? So a multiple compression tablet is basically, when they make a tablet, they have a bunch of powder, they squish down into one. So a multiple compression tablet means they take different types of powder, maybe it's a different strength or dosage form, push it into one. So this one is going to be the Ambien CR brand. So the CR stands for, it's like controlled release or something like that. But it's basically a different type of drug in each layer that they squish into one. On the other answer choices, you will kind of get that option because none of them have anything about being delayed release. One of them is Aleve, and the other one is acetaminophen. Does that have anything to do with being delayed release? No. So I'm going to ask you, which are considered reliable sources in your pharmacy? Is the Orange Book a reliable source? Yes. Is Facts and Comparisons considered a reliable source? Yes. I don't know if I've mentioned Micromedics, but that is also a credible source. Okay. So if you answer yes to all three of those, you will know which one is not credible. Okay. So this one says, which of the following statements about liquids is true? So I won't give you this one, but let's think about it. What are the benefits of having a liquid dosage form? You know, what type of people benefit from having a liquid dosage form? You know, people who, exactly, kids is a huge popular one. I might ask you, is there another age person on the other side? So just like Victoria said, elderly would benefit from this. Those are both right. So this one is, which of the following statements about the administration of ear and eye medications is true? And so this one is one of those, if you know it, you know it. But does anyone know it? What about eye drops and ear drops is important? I'll go ahead and give it to you. So just remember, eye drops can be used in the ear. Ear drops cannot be used in the eye. So you have to think about it, and maybe you can think about it like, if I touch my ears, I can do this all day, not bothering me. If I touch my eyes, they're very sensitive. So your eyes are very sensitive, more sensitive than your ears. You can use eye drops in your ears. Last one, and we are done. A drug monograph contains statements that are true about cost of the drugs in the class, blah, blah, blah. What do you consult to figure out one drug? What do you go to figure out information about one drug? Monograph, right? Mono means one. It's talking about one specific drug. Okay, so I think this is it. We are probably about 20 seconds away from cutting off. I hope this was helpful.